Hello and welcome, it's Chris from Chris for Whole Training, and welcome to this tutorial where we're going to be talking about what you can do to relieve your lower back pain. We're going to cover 4 key points. Number 1 being what people are doing at the moment. Number 2, why these are potentially less effective. That doesn't mean there's no value in them, but why they're less effective. Number 3, what do I recommend? And then number 4, why do I think these are a little bit more effective? So key point number 1 is what are people doing at the moment? Well, as a general rule, like an umbrella term, if you want to call it that, or terms, is number 1 is exercise, number 2 is stretching, and number 3 is treatment. Those are generally the places people will go. When it comes to exercise, we're talking about core strength exercise or core stability exercises. What we have to understand with those is, are they essential for the person? So do they need core strengthening or do they need core stability? Do they need both? Once we can understand that, then we go a level further or a layer further. What type of exercise do they need, or what type of exercise are they doing? Is it a sit-up, a crunch, a back extension, a twist, a side bend? As we know, those exercises aren't the most effective, and I tend not to recommend those at all. So with regards to it being not as effective, I would put that in some respects at the bottom of the pile, if not even in the pile. So that's the sort of first thing we have to understand, is exercise necessary? And then number 2 is stretches. Now, what people will generally do is they will go for hamstring stretches, or they will go with lower back stretches. And what we have to understand here is that these stretches, hamstring or lower back ones, they're generally treating the symptom rather than the cause. So if we are treating the symptom, but leaving the cause where it is, the symptom will come back. So what we have to do is work on the cause of the problem, and then the symptoms, in some respects, will just kind of fade away naturally. And then number 3, we need to think about treatments. Now, when I'm talking about treatments, I'm talking about like a massage therapy or some kind of spinal manipulation. Now, as a sports massage therapist, I know there is value in doing that, but I also know that there are limits to that. And I can only talk about sports massage therapy because that's my, let's just say, field of expertise, or that's where I'm qualified to be able to, in some respects, talk about. So with regards to the limits for it, what I do know is that it can get someone out of their initial uncomfort, their pain, or their backache. So I know that that's possible. But what I also know is that there's a little bit more to it. So there might be exercises, there might be stretches that need to go with it. But that is just, the massage therapy is just one piece in the greater puzzle of lower back pain. So we have to use it that way. What we can't do is treat the lower back pain, remove the pain, send them on their way, and then they come back in 4 weeks' time in the same position they were 4 weeks previous. What we have to do is, again, remove the initial pain or problem or whatever it might be, give them some extra bits to treat it and to help reduce the lower back pain, and then when they come see us in 2 weeks or 4 weeks, they come back in a better state than they were previously. And then we work in that fashion. So we're taking 2 steps forward, and sometimes we might take 1 step back, but 2 forward, 1 back, 2 forward, 1 back, rather than 1 step forward, 1 back, 1 step forward, 1 back. So that's kind of how we have to think of it. Key point number 2 is talking about why they're less effective. Now, I've already been describing it as we've been working through, but just to focus in on it a little bit more. Number 1, they're generally generic. So when someone will select some exercises from online, they will generally select sort of general exercises that people have found useful. Now, again, there's not any degree of specificity to it, so those exercises aren't tailored to the individual. They haven't looked at, do I need core strength, core stability exercises, or both? What type of stretches do I need? I'm just selecting the hamstring stretch and the lower back stretches that everyone seems to be talking about. Also, they tend to give us a short-term fix. So as I mentioned with the treatment, with the sports massage therapy, I know the limits of it. Although I am qualified to administer it and treat people with it, I do know the limits of it. So I know then how to communicate with the individual to be able to not only get the most out of those short-term limitations of the sports massage, I also know what we need to be able to do to get the long-term effects. So what I need to be able to do is create the pain relief, and then I need to work on removing the cause once they're out of that pain. So that then breeds into a much longer term approach to it. So what I'm not trying to do is just relieve their pain, send them on their way, knowing that they'll be in pain in a month's time and they'll come back to me so I can relieve it again. And then that cycle just repeats on a monthly basis. It's very much trying to educate the individual that their back pain is specific to them. There are specific things they can do to overcome their lower back pain. And this massage treatment is one of them to give us a window to be able to do that when they're out of pain. The final thing is, do they need exercises, stretches, or treatments? Or do they need all three, or do they need just a combination of two of them? So again, that questioning process, that consultation, that understanding of lower back pain will allow us to be able to do that. So we can then look at what specific exercises does that person need. Because if they're showing good core strength in the front of their torso, but not good core strength in the side of their torso, we know we need to focus on that part of the torso, so we know the exercises to select for that over the ones for the front part of the torso. So it's understanding that so we can select the right exercises. If they've got good all-round core strength and endurance, is it an instability through the hip, spine, shoulder, wherever it needs to be? So we might need to select exercises that go to those areas. And again, we might need to select a treatment if there is global tightness through there, so we can relax those muscles, so we can get more from them when we do exercise and stretch. So it's very much understanding the lower back pain first, and then we can select a much more specific treatment for the individual. So what we're now going to do is look at my recommendations. Now we've got or sort of started to paint a picture of what people are doing already. Key point number 3 is looking at what I recommend for people to start doing to relieve their lower back pain. And it comes in 3 steps. It could be, a 3-step method, a 3-step formula, whatever you want to call it. But essentially, we need to, first of all, gain a better understanding of the lower back pain. Now, I've been alluding to this as we've been going along with regards to what people are doing and why it's not so effective. Because they're not really gaining a great understanding of the lower back pain. They're just selecting things that they're being told to do on the internet, and they're not really gaining a better understanding of their specific lower back pain. Because if we can find that there are deficiencies in the endurance and the strength of the core, that's the place where we need to go. Or we might find instability in the spine, where we need to go there. If they've got deficiencies in both of them, we need to build both of them up. But it's that understanding that we need to find. Also, we need to think about what are the patterns in their pain. What are the patterns in when they're pain-free? Because if we can understand those patterns, we know which ones to focus on and we know which ones to move away from. So if we can start focusing on the pain-free patterns, we're going to be in a much better position to overcome lower back pain. The second thing is starting to then reduce that lower back pain. So as I've mentioned, we've started looking at where are the deficiencies. Where are the deficiencies around the torso that we can start using stretches and exercises for? As long as we're selecting the right ones, we should then start to see the pain reduce. And it's the same with movements, postures, positions and loads. So this is a little bit more everyday life. So it might be that carrying shopping bags aggravates your lower back, or picking up a box off the floor that you have to do regularly for work aggravates your lower back pain. It could be sitting down, it could be standing up, it could be walking that aggravates your lower back pain. If we can start finding out those, and then we can start putting in strategies in place to reduce that, then we've started completing step number 2. So we've understood it well enough that we know what pieces to put in place, and then we can start to see the lower back pain start to reduce. Which then brings us on to step number 3, which is then maintaining that spine health that we've started to develop. So as the pain reduces, what we can start to then do is start putting in place the spine health measures. What a lot of people try and do is they don't try and reduce the pain. They try and build on top of an unhealthy spine, for example, or a painful spine. And if you're putting building blocks on top of that, you've got a sort of a crumbling foundation, and eventually that foundation is going to show itself and it's going to become painful again. So what we have to do is we have to build the foundation by understanding the lower back pain and then starting to reduce it, which then allows the spine and the tissues around the spine to begin to heal. And then what we start doing is building that spine health by putting in, again, more of the right exercises, more of the right stretches, and more of the, let's just say, healthy everyday activities to begin building that spine so it can stay pain-free for longer. And point number 4 is, why do I think this is a more effective way of relieving lower back pain? Well, number 1, it becomes a lot more specific to you. Now, I know, because of the years that I've been doing it and the amount of people that I've been doing it with, that there is a pool of exercises that I tend to use as my resource for helping people overcome their lower back pain. But which ones I select comes from understanding that person's lower back pain by going through an initial questionnaire, a consultation, an assessment of their lower back. That then helps me think, right, we need to start using this exercise and that exercise and that exercise. Or we need to start using this stretch, that stretch, or the other stretch. So I'm not just saying, right, just go and build your core strength or just use these exercises. What I'm trying to do is understand that person's lower back pain so I can then start thinking, right, okay, we need to select that exercise and we need to select that exercise to then put together a specific rehabilitation program for that person. The next thing is it helps you understand, as I've mentioned, what exercises, stretches and treatments to use. So through that sort of consultation and understanding process, or step 1 if you want to call it that, we're using those exercises and stretches, and what we're then able to do is then review that, which is then the final sort of step as to why these are more effective, because it gives you that opportunity to review it, which then makes it into a little bit more of a longer term fix. So if we are understanding the lower back pain, we're then selecting the right exercises, stretches and sort of everyday activities and movements that people are doing to make them pain-free, so reduce their lower back pain and improve their pain-free back. If we can start doing that, what we can then do is go back to them in 2 weeks' time and say, right, how are we getting on? Where are you with it? How are these exercises working? Which ones are working better than other ones? Where is the biggest deficiency? So which hasn't got the most improvement? So we can start building up those and we can start pushing forward with other things. So that review and that feedback is an essential part to keep it progressing to that long-term rehabilitation process, because that's how people overcome lower back pain. It's not, I go and see someone for a treatment, I reduce my pain, it goes away for a week, and then slowly over the next 3 weeks it comes back, and then I go back and see them. That's not overcoming lower back pain. That's just treating a symptom that's always there. To overcome lower back pain is a much longer term approach, and thinking, how can I go from being in pain all the time to being in pain 75% of the time, and then 50% of the time, and then 25% of the time, and then I'm not in pain anymore. Because when we use that longer term approach, that's how we overcome lower back pain, which is why I word it like that. Because it's about overcoming the lower back pain, not just about treating it, waiting for it to come back again, and then treating it again. It's much more about a long-term approach to be able to take someone from being in pain to not being in pain, but then that pain not coming back again. So that is how I would recommend people to go about their lower back pain rehabilitation, which is number 1, understand the lower back pain. Number 2 is start reducing it. And number 3, because the lower back pain is specific to you, you know what exercises, stretches and treatments to use, and then you're giving yourself the opportunity to review and feedback over time, so you're using that long-term approach to overcome your lower back pain. So hopefully that's been helpful for you. Hopefully it's given you a better idea into how you could go about relieving your lower back pain. If you want some help from me, you can go to the link below and you can enroll in my one-to-one coaching, where we will do exactly as I have described. You will go through an initial questionnaire, a phone consultation or online consultation with me. I will then send you through a self-assessment. Again, all this information will come to me. I will then start building a bespoke rehabilitation program for you, so you can then start overcoming your lower back pain and building that greater spine health for the future. So if you want to do that, click the link below. Many thanks for watching. My name is Chris from Christopher Holt Training. I will speak to you in a future video.